What's up, Steve? Well, this Heart Month, we're going to talk about nutrition and how it plays a role in our health. So I'm in the kitchen now with Dr. Alan Taylor from MedStar Washington Hospital Center here to talk about ultra-processed foods and our heart. Thank you so much.
Good morning. Thank you.
So when we say ultra-processed food, you hear it all the time. How do you know if a food falls in that category?
Great question. You really can't by looking by a labeling, but if you look at the label and it doesn't look like what it is, like a corn chip doesn't look like corn. There's more than 5 ingredients, or there's things in those ingredient lists you don't understand. It sounds like a chemistry experiment. It's probably ultra-processed.
That's how you know. And when it comes to the risk factors and things that it does to our heart, our bodies, what kind of risk does it cause, those type of foods?
The problem we have is over half of our calories are coming from this right now, and it's related to weight gain, diabetes, heart disease, dementia, even mortality. And so our diets are so enriched with this, we have to start working these out of our diet.
Why do you think that is? Because I think sometimes people think it's just a choice. Sometimes it could just be out of convenience, affordability. Even.
Yeah, if you're watching, you're probably eating some of these foods already today or planning to. It's convenience. It's the way food is put on the shelves for us to be a convenience society. And it's some of it's true access, the ability to access fresh foods. But a food you eat should look like what it is if it's truly not going to be ultra-processed.
All right, that's the best indicator. So let's walk me through some of the things that you brought and maybe some alternatives that you would offer.
Right. Well, these little muffins, they look delicious, but they have
And they are delicious.
They have an ingredient list which is 20 things long and looks like a chemistry experiment. That's ultra-processed.
Okay.
And, honestly, it should look like what it is. These are all packaged convenience foods, often high in salt, high in ingredients, high in modified sugars, modified oils, and those are the tip-offs. So we've got to start working our way back out to sort of no more than maybe 1 in 5 of our calories are coming from this. So start being aware and reading labels, looking for this and looking for alternatives.
And you can have this, just not all the time, right, doctor?
That's right. I think the healthy level is considered about 20%, whereas right now we're 50, and your children might be as many as 2/3 of their calories are coming from this.
Gosh, and so what's your recommendation then to kind of wean us all off, right, that ultra-processed kick that many of us are looking for? How can we make those small steps for better health?
Yeah, we give this advice to patients, eat a Mediterranean diet, which really is just a whole food diet. And so we have to look for foods that look like what they are. It doesn't look like it's been modified into something different. Think of ketchup. It's made from tomatoes, but it looks nothing like a tomato. Think of a Dorito.
Well, it is red, doctor.
It looks nothing. It looks nothing like a piece of corn. And so I think that is the key thing. And we have to make choices in the grocery store, make choices in restaurants. Eating out is also a big source, fast foods, of ultra-processed foods. Soft drinks, sugary drinks, all these things I think need to start coming out of our diet so we can avoid these negative health consequences.
And it's so good to cook for yourself, too, for the reasons you just mentioned, because you know what you're putting in your food.
Yeah, and that's a tip-off. If you look at a label and you see things that you don't cook with, that's a tip-off that it's ultra-processed.
Got it. In this Heart Health Month, anything you want to say to maybe even debunk a myth that's out there? With the internet, with social media, there are self-proclaimed doctors, saying all kinds of stuff. Anything you want to debunk today?
Well, I think on the subject of diet, there are many, many diets out there, and I think the idea, they all come down to eating whole foods, foods that aren't processed, foods that are lower in fat, but a balanced diet, as I think the best one. The Mediterranean diet includes some olive oil supplementation, tree nuts are okay, and that's a decent diet to follow if you have heart disease. But overall, if we move towards fewer ultra-processed foods, we'd be healthier as a society.
And be on the prevention end of it as opposed to treating it after the fact. Dr. Alan Taylor, thank you so much.
Thank you so much.
You don't have to take these snacks back with you.
The guys already asked for them.
All right. But make sure you all eat healthy to protect your heart. We'll be right back on the other side of the break.